Well, a warm welcome to today's talk. It's Tuesday the 4th of May. Some good news from the UK today, some interesting news from the United States, but of course we need to start off with India. Now let's just start off with a bit of context to look at that. You've all been watching the news reports, I'm sure. People are still struggling to get into hospitals. People are still dying through lack of medical care. People are still dying through lack of oxygen. It's just an appalling situation. So here we see the graphics. Now these are new daily confirmed cases per capita, per million people. So the UK we see a low, then the United States. India is going higher. But of course it's nowhere near what we were in the UK and the US. But of course we have to take into account the testing, which in India is quite low. Now having said that, the testing seems to be going down a little bit in the States as well, but basically in India the testing's not picking up many of the cases at all really, or a minority of the cases. Share of the population fully vaccinated, another major factor. United States, United Kingdom. United Kingdom's rapidly catching up on fully vaccinated people actually, because we had the one dose policy followed by a long gap. So I'm hoping to join this this trend fairly soon. But seriously, if we see India down there, it just shows the difference. And basically at the rate that India is being vaccinated at the moment, it's going to take the next couple of years to vaccinate everyone. It really does need a step change in what's going on in the Indian vaccination program. And that requires international collaboration, and it probably involves lifting of some intellectual copy rights or patent rights as well. Overall vaccines, here we look at the state of the world really, a snapshot. India there, then Brazil, then Turkey, then France, Germany. It's good to see that the European countries are picking up a bit now. The rate is starting to accelerate. Serbia, Uruguay, Bahrain, Hungary. Hungary, of course, is using Russian vaccine, Sputnik V. Chile, also using Chinese and Russian vaccines. United States, United Kingdom, and of course Israel leading the way. And Israel has the reduced cases and deaths to prove it, as indeed we are developing in the United Kingdom and in the United States now, although the rates are dropping off really relatively slowly in the States, as we looked at yesterday. Now let's get on to a little more detail about India now, because it is still distressing because of the unnecessary deaths and unnecessary suffering. So, technically that's actually a bit of a reduction in the number of new cases on what it has been. It has been nearer the 400,000 mark, but we know it's an underrepresentation. So this 20 million is a gross underestimate. About 3,500 deaths in the year. But again, we're going to see that these are underestimated. Now, what's going to happen in India over the next few months? Well, for the next couple of weeks, things are going to carry on getting worse. Well, they are going to carry on getting worse. There's no real doubt about that, I'm afraid. Peak cases will be on the 15th to the 20th of May. Peak deaths will be delayed by 2-3 weeks. Peak deaths are going to be in June in India. So this level is going to carry on increasing for the next few weeks, and deaths are going to carry on increasing for the next 4 weeks. And there's going to be high levels of cases all the way through to August. So it's going to peak and then plateau, and then the plateau is going to drop off slowly, is the most probable contingency for India. So it really is going to be a problem for some time. A vaccine rollout in India, all over 18s are now eligible because they simply don't have the stock, so that is an irrelevance. People are turning up for vaccines, and there simply isn't any. The numbers are simply not being produced and distributed. So the fact that it's available to all over 18s is irrelevant. 150 million doses given, but remember there's nearly 1.4 billion people in India, so only a little over 10% of the population. Fully vaccinated, it's only 2%. Now, the United States today is restricting flights from India. Now, we did critique, shall we say, the policy of the United States on this recently. So they're now restricting flights from India, but people that have the residency rights in the United States and people that have citizenship in the United States can still go back. And there's a risk of the transmission of the India variant. And we looked yesterday that there is already, in fact, India variant in the United States. And the CDC does not seem to be monitoring the India variant specifically very accurately. So just a bit concerned that the American authorities are somewhat dropping the ball on the India variant, hoping that it's going to be okay. But I hope it's going to be okay, but we don't know yet. There is an element of risk here. And I really do feel it's important to err on the side of caution, as the Australian authorities are doing, of course, by not even letting their own citizens from India back into Australia to protect the rest of the Australian population from the India variants. Australian politicians getting quite a lot of stick for that, but you can't argue with the fact that Australia has essentially no community transmission, and neither has New Zealand. So their policies are harsh, but they are effective, and they're protecting the rest of the population, of course. We always have to look at the people that are being protected. Citizens and people with residency allowed in. Now, Varanasi, for example, in India, you've probably seen pictures of Varanasi. It's a famous Hindu pilgrimage site. It's Narendra Modi's actual personal constituency. And it's where the Kumbh Mela festival was based around as well. But of course, since then, people have caught the infection at the Kumbh Mela festival and have gone to all parts of India. So this is spreading, but this particular report is from the Varanasi area. Now, these are the main cremation grounds in the area, and funeral pyres have been burning non-stop for the past few months, according to local residents. Normally 80 to 90 cremations a day in this area, now 300 to 400. So when we look at the number of people being cremated in India and we look at the official death tally, they don't add up. This number is too low, unfortunately. So there's a lot more cremations going on than are officially recognised. Now, the other concern is that the virus is spreading to Indian villages. Now, the medical facilities in Indian cities aren't great. In the villages, they're often essentially, well, they are non-existent in a lot of villages. There basically isn't anything in a lot of Indian villages. So when the virus starts to spread there, people aren't going to get treated and the death rate is going to be high. Now, this is a block of 110 villages, 230,000 people. This particular block near Varanasi. The villagers tend to arrange themselves in blocks so that at least they have some voice with outside government. Each village reported 5 to 10 deaths in recent days, some 15 to 20. So it is in the villages now. Now this is the leader of this block of villages, and he says this: there's no hospitals in the block, no oxygen, and no medications. There's no space in government hospitals. So already bad news. There's just no provision in the villages. And private hospitals asked for a deposit of nearly $2,705 nearly 2,000 English pounds, 200,000 rupees, or even more, even well more than that, even more than double than that before they even look at a patient. Now, of course, we're dealing with people in the villages who earn perhaps $2 or $3 a day. I mean, these are like, they might as well ask for the moon and the stars for most villagers as to ask for this kind of money. It's just, human life is reduced to a cost. It's just a terrible situation. The villager elder there says we've nowhere to go. So the government hospitals are full. Private hospitals, to you and me, it's like charging £500,000 or something. It's just an unimaginable amount of money. And that they basically we have now groups of people who have no access to healthcare whatsoever. Another village here. Situation in village was worse than in the cities, this resident says. And she says this, I think it's a she. If you tested everyone in my village, yeah, it is. If you tested everyone in my village, Of 2,700 people, at least half would be positive. How does she know that? Because they've been tested? No, because so many people have cough, fever, pain in the lower back, weakness, loss of taste and smell. So these are pretty diagnostic features. So it looks like about half the people, about 50% of the village, have got the infection all at the same time and have no access to medical care. Now, the United States and the UK especially are flying in a lot of aid to India. But is it going to diffuse to the villages? Not quickly, if at all. Other countries are sending aid as well, but again, is it going to diffuse to poor people in the villages? Is it going to get through Indian infrastructure to the poor people that are suffering in the villages? Very little, I'm afraid, is the answer. People are being reported as gasping for breath. And you certainly on these videos, you see people with a respiratory rate of 30 or 35 or something. It's just horrible to watch. And the deaths in this village are not taken into the official statistics, and there's no testing. So again, we see that things are underreported. So really quite distressing, especially for the poor people in India. And going to carry on being so for some time, and it's just this horrible feeling of not being able to directly help. You're experiencing the same thing. Right, the United States. Now, Dr. Fauci has recently said that herd immunity with the new variants probably won't be reached to 70 to 85% of the population being immune, mostly through vaccination, of course. And to be quite honest, this is quite a high bar, and things won't get fully back to normal till we have herd immunity. So as a result of that, it's almost certain that children, and the next step is 12 to 15-year-olds, are going to be vaccinated soon. And there will be an announcement on this in the next few days, almost certainly. So Pfizer, the FDA, expanded emergency youth authorization to 12 and over is expected to come through leaks in the next week, 1 week perhaps, days, sort of 5, 6, 7, 8, 9, next few days. We don't know when, of course, exactly, but we do know that Pfizer submitted the data from their trials, and there was 2,300 people, young people aged 12 to 15 years of age, who were trialled. Now, in this 2,300 people in the trial, 18 people tested positive after 2 shots. And every single one of them was in the placebo group. There was no one tested positive in the vaccine group. So they probably had about 1,150 in each group. So the 18 positive cases, every single one in the placebo group. So from this, it's a limited data set, from this, they've concluded that the vaccine is safe, as whatever that word means, safe to all intents and purposes, I think is what they mean. We can never guarantee anything as being safe, as we know. But from that information there, it is 100% effective, because not one young person in the vaccine group got the infection, but 18 did in the placebo group. So every one of the 18 cases in the placebo group. Follow-on trials from younger children are ongoing. So it's obvious, isn't it, that when more younger people are vaccinated, that's going to increase the overall herd immunity effect, which is what is looking like it's going to be needed. Follow-on trials from younger children are ongoing. Don't know what age down to. Presumably the next age group will be like 5 to 12. Moderna's currently doing trials in 12 to 15, and Johnson & Johnson are planning trials for their single-shot vaccine as well. So this will greatly add to the herd immunity effect and the potential eradication of the virus. But young people and children are going to need to be vaccinated at some stage. And of course, childhood vaccination is common for all sorts of things. It's just that we're feeling our way into these new vaccines, and that trial data is looking good. And this is going to have to apply all around the world. The United States is going to be first, but it's going to have to happen in the UK, Europe. It's going to have to happen everywhere to get the herd immunity numbers up. I can't remember what they're doing in Israel now. I think the younger children, they reckon it won't be necessary, but I can't remember the age in Israel, actually. I'll check on that and let you know. Now, the UK, of course, we've got this, we've been looking at it for a while. timeline, this road map, or whatever you want to call it. And the next one's the 17th of May. So from the 17th of May, if the data allows, outdoor gatherings up to 30 people, 2 households can mix indoors, pubs, restaurants eating inside, cinemas, museums, hotels opening up to 10,000 spectators, outdoors at sporting events, and consider the potential role of COVID status certification. So that's all coming at the 17th of May. Then the final step, 21st of June, 5 weeks after that, when basically social distancing is hoping to be lifted, although mask wearing may still be required. Now, moving towards that, we've had this rather bizarre, I think, sort of series of experiments in Liverpool. Now, keep going on the wrong one. There we are. Now, this is actually empirical science, large-scale experimental trial, so it kind of makes sense, but it's also a bit strange. So, Liverpool experiment. So, last Friday and Saturday night, nightclubs pilot 3,000 events per night. So they had experimental nightclubs when people could pitch up. Well, they had to get tested first. Sunday, they had this mini festival in Sefton Park. It's an official government trial event, so it's all legal and everything. Everyone had to be a ticket holder. Everyone had to have a supervised lateral flow test the day before. So there could have been a few false negatives. That's quite possible. That's one of the things they want to test. They had to be negative, of course, to attend. And they're strongly encouraged to take a PCR test on the day of the show. So strongly encouraged to take a PCR test on the day of the show. And of course, if it was positive, they couldn't go. And a retest, another PCR test in 5 days to see what's happened. So it's basically one heck of a big experiment. So interesting. It's all government sanctioned. It's official. Studying audience movement, interaction, ventilation, duration, catering and alcohol consumption, which we could assume would probably reasonably high. Now, apparently people were like in this party listening to loud bangy music for 6 hours in fields and drafty barns, and as they were doing this, you can gather I didn't attend. as they were doing this, apparently there's people in clipboards walking around like writing things down. So interesting. Now, will this be written up as a formal scientific experiment in the peer-reviewed literature? I would certainly hope so, because what it is one heck of a big experiment. So I just thought it was quite interesting. Now, moving on to perhaps good news. 17th of May in the UK. Now, we have this traffic light system for travelling. So the Greenlist, what's going to be on the Greenlist? So if you've Greenlist countries, you have to have one test, 72 hours of departure from England. Presumably that's a PCR test. It doesn't stipulate that. This is coming from the Foreign Office. It's a bit confused because the Foreign Office are making guidelines, and it's the Department of Transport that's actually making the rules. So but I think we can assume the government departments are vaguely talking to each other. So a test 72 hours before departure. This is England, of course. Now, this won't apply to Scotland, Northern Ireland, and Wales, because the devolved authorities there have to assert their authority to make it just that little bit different from England. So it's going to basically be the same, but it'll just be enough different to say, oh, we're doing it our own sweet way, which is political. Which the reason I'm making light of that is I find this politicking around with it distasteful. But that's what happens. They always make it just that little bit different so they can say, well, we're not doing the same as the rest of the country. I really find it distasteful. But anyway, that's these are to do with disease and life. Just to politic around with it is not nice. Anyway, at least one PCR test on arrival back to England. Again, this is the English authorities stipulating these rules. Now, the countries that you go to are going to have high vaccination rates, low prevalence, capacity for genomic analysis, so they know whether there's the UK variant, the Spanish variant, the South America, the Brazil variant, the Indian variant. So they're going to have capacity for that. That's going to be the criteria. And health systems that tourists can use should they become sick. So these are the criteria for inclusion on the green list or in other lists. But of course, if they didn't meet them, they go onto the amber or red list. Now, do not book your holiday on what I'm about to say. I'm not taking responsibility for this. But Smart Money says Gibraltar, Malta, Israel, Iceland may well be green. Portugal may well be green. We don't know yet. This is going to be announced in the next few days. The Greek islands, Rhodes, Kinthos, Corfu and Crete may be green. Canary Islands, Israel, very likely to be green. Canary Islands, Spanish, of course, likely to be green. And the big mystery, what about the United States? Is the United States going to go on the green or the amber list come the 17th of May? My bet at the moment is it will probably be on the amber list. Probably. You tell me, what do you think? Does the United States meet the criteria? High vaccination rates? Yeah. Low prevalence? Capacity for genomic analysis? Health system for tourists? Well, certainly. But interesting to look at the United States in those terms. Will it meet those criteria? We will know in a few days. So don't book anything based on that, whatever you do. We don't know yet, but that could well be the way it works out. Now let's finish on a good news story. Now there's been a lot of social media pressure on the Medicines and Healthcare Products Regulatory Agency in the UK to say definitively whether alcohol should be abstained from for particular periods of time before the vaccine and for particular periods of time after the vaccine. Now this started in Russia. Now to be fair, there's a big alcohol problem everywhere, but in Russia particularly when people are drinking huge amounts, so some Russian officials said no booze before and after the vaccine, which was fair advice at the time. But the MHRA have spoken. So it's now definitive. In their press release, it's not on their website. I had a good look around, but it's on a press release that there is currently no evidence that drinking alcohol interferes with the efficacy of the COVID-19 vaccines. And then the universal cop-out, which for the HMRA is pathetic to include that. We would advise anyone concerned about this to talk to their healthcare professional. But of course, the healthcare professionals will only do what the HMRA says. So I think that's a bit of a pathetic cop-out for the HMRA. But there you go, that's the situation. So when I get my second Pfizer vaccine, I may well celebrate with a can of lager. We will see. Okay, that is us for today. So it's not just India, it's the countries round about it. Pakistan, Bangladesh, Nepal cases are going up. And cases, as we saw, going up in Cambodia and Thailand, for example. Philippines and Indonesia as well. We have to say at the moment they are at risk from these new variants. So a bit of a tale of two worlds really at the moment. Good for some of us, and let's spare some thought time for those that are still severely suffering, especially in poorer countries. Thank you for watching.